myself.
Okay. All right. So I'll let you take it away.
Okay. Just be sure to get my good side here for
Okay.
publicity.
All
Okay.
right.
So like she said, my name is Luke Davis. I am only 23 years old. I've been a nurse for a little over a year. And I work at EW Health Hospital in Madison in the Trauma and Life Support Intensive Care Unit. So on a regular day, we see trauma patients, medical ICU patients, surgical ICU patients. So a really wide range of things. But recently, of course, with the COVID pandemic and it reaching the Midwest, specifically Wisconsin and Illinois, and we've been seeing an influx of a lot of patients. And so there have been a lot of changes in the hospital. Our unit has actually been converted, half of it into a coronavirus-only ICU. Several other floors have done the exact same thing. And so for the last several months, I've been working exclusively with coronavirus positive patients that are critically ill. So while I may be a new nurse, I do feel I have a good amount of experience now with this particular population. And I really would just love to share with you all kind of how things are going in the hospital, how things are looking in the community. And then I would really love to get some questions from you. So be brainstorming the good ones to try to stump me if you can. But I'll be happy to answer them as best I can. And if not, maybe provide some good resources. So does anyone have any burning questions straight off the bat? Anything they'd like to know about me or coronavirus in general?
Did you go to UW?
Good question. I did not. I went to the University of Wisconsin-Platteville for 2 years in preparation to go to nursing school, and then I chased a girl to Iowa. That did not work out. Update. So I went to school in Iowa, in Cedar Falls, Waterloo area, if you've ever been. So once I graduated in December of 2018, then I knew I was going to come back here. I've always wanted to work in trauma and life support intensive care, and so it was a really good fit to come back home. I'm from Oregon, so that homecoming was very nice, and I feel fitting, to be able to support my community in this time, especially to even see some people in the hospital that may have some connections with me, and so it's been really cool. Good. Any other burning questions? We'll get to more Q&A, I suppose, towards the end here. But anybody have any others?
Every day, do you need to wear a mask and a shield and a gown?
Yeah, good question. So whenever we're out in the hallway, just walking back and forth, we wear our mask, and if we're ever in direct proximity with a patient or fellow staff members closer than 6 feet, then we also wear our face shield. Out in the hallway, we don't wear a gown or anything, but we do wear a lot of extra PPE, personal protective equipment, when we enter specifically a COVID positive patient's room. So for us in the ICU, because it's considered high risk for exposure if a patient is ventilated with a breathing tube, we end up going in with what's called a PAPR, or an N95 also, but I personally wear a PAPR. It's like those big hoods that you've seen on TV, the white hoods with the plastic clear face shield, and then that's hooked up to an air filtration unit that pumps clean air into the mask for us to breathe, and then that is then expelled through the edges of the face shield, giving us that clean air to breathe. We also wear gowns, and then we wear long cuff gloves instead of just your regular nitrile gloves. So we wear that too.
Luke, do you want me to share the photo you shared with me for the presentation?
Sure, yeah, that'd be great.
Okay.
Luke, I wonder if are you quarantined when you come home?
Good question. So I've tried to limit my exposure to my family. The convenient thing is that my mother actually works in the same exact unit as I do. I know, crazy. So she and I have gone through a lot of this together. One of the main things that we'll do when we get home, we take off our scrubs, put them in a plastic bag, and then put them in the garage. Hey, there I am. What a handsome devil. So that's kind of the gear that we wear when we go into a patient room. Those long gloves that you can see, the gowns, and then that's the PAPR with the air filtration unit on my waist.
So you don't actually have to wear a mask when you wear this?
That's right. Yeah, that does the job of the mask. But anytime we're just out in the hallway, we wear a surgical mask. Yeah. The other thing people can wear when they enter these rooms is the gown, the gloves, and then an N95 mask, which is kind of specialized for viral protection, droplet oils, things like that. It does a better job with than a surgical mask. And then they wear the face shield as well. So yeah, that's that.
Can the virus be transported via your shoes?
So yeah, it can. What we do when we go to the hospital, we wear one pair of shoes in, and then before we step foot on the unit, we change into what we call like our work shoes. So we have a separate pair of shoes that we put on while we're there, and then we put foot coverings on as well. And then once we leave the unit, we take the foot coverings off, change our shoes into our home shoes, come home, and then take those shoes off and leave them in the garage or kind of a designated area. So there's that. With those scrubs, we leave them in that plastic bag for roughly 2 to 3 days, and then we wash them. Now, these are all really protective precautions. The average person going out, for groceries or anything does not need to come back and keep their clothes in a bag for 3 days. And I'd be happy to talk more about that. I have a brief little PowerPoint with some basic information I can show. But yeah, that's sort of a picture of what we do, how things are looking right now. I'm sure you're all wondering too how many patients we have, and if there's been the rush that experts have been warning us of. So I can speak to that. There have been quite a few coronavirus positive patients in the hospital. However, with risk mitigation techniques like social distancing, the stay-at-home order, the populace has been exceptional, really exceptional in maintaining that good social distancing. And so we really haven't had the massive rush that New York and Chicago, New Jersey have been having, which is wonderful. However, there's still the risk, and so we just ask the public to continue to do those social distancing efforts. And while we're slowly starting to open up, the country again, just to be really mindful of the risks for exposure, risks for transmission, and continue to take those steps. So any other questions here straight off the bat? Otherwise, I can load up that PowerPoint.
Yeah, there will probably be questions later.
Yeah.
Hey, Luke, it's Dawn. I have a quick
Hey,
question.
Don.
Have you guys had any shortages of PPE at your hospital or in the area, I guess, that you've heard of?
Yes. So we, given that this is a global pandemic and a lot of PPE supplies come from overseas, there's been a cutoff of supplies, and so we've been very limited in things. Most notably, masks, I'd say, would probably be the biggest thing. We use a surgical mask on a normal day before COVID, before any of this happened. On a normal day, we'd wear a surgical mask into only isolation rooms that require a mask, droplet precaution rooms, like someone who has influenza or RSV, things like that. And then once we leave the room, we just throw that out. Now what we're doing is wearing the same surgical mask indefinitely. So we wear it until it falls apart, basically. Like I said, we wear those PAPR hoods or the N95s with the face shields into the COVID positive rooms. When we leave, we sterilize that stuff and then put it in our brown paper bag until the next time we go in the room. But those regular surgical masks that we wear in the hallway when we're interacting with one another, those masks we are to keep indefinitely. So they can get a little scratchy, a little itchy, can be not the most comfortable thing, but as far as safety goes, it's the best option if two were on a PPE shortage. It's sort of unprecedented times, and so unprecedented measures that needed to be taken. But yeah, good question, Don. That's a good one. So, okay, I tell you what, I will go ahead and share my screen here. I have just a quick PowerPoint. It's pretty basic information, nothing crazy. But can everybody see my screen? This, Yep. Okay. All right. So, general information about this coronavirus. There has been some maybe disinformation out there, whether that be in the media, social media, or just from someone you've heard. and I think it's good to just clear the air. So a coronavirus is actually a broad category of virus. It's not just one in particular one. We really discovered it in the late 1960s. There are many, many, many coronaviruses out there, but 7 have been identified as infectious to humans. So that jump occurs when several animals perhaps get together, are near each other in close proximity, and spread that virus to one another. And in the process, it can mutate so that then it is able to latch onto human cells. And that's what causes the jump in species from animals to us. So current working theory is that this new coronavirus, the novel coronavirus of 2019, spread from bats and possibly to pangolins, which are like those dorky armadillos. I think they look a lot like me, or perhaps Aaron Frank, if you know him as well. But that has been the jump from animals to humans. Originally in Wuhan province, China, at a fresh livestock market. And so from there, it spread globally, of course, as we all know, as we all saw in the news. And we've been pretty much just responding to how it's been spreading, not really having any prophylactic measures like a vaccine quite yet. So then why it's called COVID-19. Does anybody know? Anyone want to take a crack at why it's called COVID-19?
It was discovered in 2019.
That's right. So CO stands for coronavirus, VI stands for virus, and then D is disease. So coronavirus disease of 2019. Some people have thought it means that it's the 29th or the 19th coronavirus, but that's actually not true. It's just found in 2019. The image that you see here is just an artist's rendition of those proteins and the virus in general. So those S proteins, the pink things, are what latch onto the cell and allow the virus to inject its RNA into the cell to basically hijack our own cells to make more copies of itself. So that's just a general picture of how that works. Now, I think the big question too is this the same as the flu? Is it the same as influenza? Is it to be more feared, less feared, anything like that? And for several reasons, the most I can tell you is that it is not the same as the flu. It is more dangerous. So a good virus, a virus that is successful in surviving for a long period of time, is one that's not too lethal, but spreads very, very easily. If we think about the virus as a person or something that wants to spread, we want it to not be too lethal, because if it kills its host immediately, it can't spread to other people, can't spread and survive. And if it's not transmittable enough, but not deadly, then we hardly really notice it because it doesn't spread in the population. And so influenza, we work with a value called an R naught. It's kind of like the spread of the disease. So the R naught for influenza is around 1, meaning that when one person gets sick, they usually infect one other person. So it's around there. With coronavirus, the issue has been that R naught is anywhere between 2 or 3 in some populations. And so one person is now infecting 2 or 3, and that then means this person is infecting 3, and so on and so on. This person's infecting 3, and so on and so on. And this one's infecting 3. And so it grows at an exponential rate rather than linear at a 1, 1, 1, 1, 1. So clearly that is of worry to healthcare workers. It's of worry to the population, because it means that it's spreading much, much quicker. And the worry too is that it's more lethal. On this next slide, the mortality rate actually for coronavirus 19 is around 1% now, around 3% in some limited populations, people that don't have great access to healthcare, people with a lot of comorbidities. So that might not seem like a lot, but because it's spreading like wildfire, a 3% mortality rate is terrible. Initial estimates for mortality on a national level, when it first got to the United States, if we did not take any prophylactic measures like social distancing, stay-at-home orders, it was estimated about 100 million people would get sick and around 1 million Americans would die. So thinking about it in that perspective, it's very worthy of the word pandemic. With influenza, hospitalization rates around 2%, and in general, in the average person, there are few long-term complications. You have the respiratory illness, you recover over the course of a few weeks, and your body then builds up that immunity to that virus, and you have fewer complications. In my experience, however, with coronavirus, this novel coronavirus, there's a much higher likelihood of long-term complications. It doesn't really just stop at the lungs. It ends up turning into, at least in the critical cases that I've worked with, a more systemic end organ type illness. So we see a lot of issues with kidneys. We see late myocardial issues with like a cardiac myopathy and people having poor conduction in their heart then. And these things then may last for months, years, even be lifelong. So that makes it definitely more scary. However, it is not the most deadly or the most contagious viral illness. Ebola has a kill rate of about 50%. So if you think about Ebola being a pandemic of this scale, that's much more alarming. However, the infectious rate of Ebola is much lower. It doesn't spread as quickly, partially because of that increased mortality. So some things that I would just recommend to you, things that you probably already know, because it's just general knowledge at this point, with the media telling it to us, and just thinking through things. First and foremost, please wash your hands. If you don't have some hand sanitizer too, you can use that. Soap and water kills this virus. 70% alcohol hand sanitizer or above kills this virus. So do that regularly. If you're out and about, every time you leave a store, every time you leave somewhere, be sure to wash your hands. Other risk mitigation strategies. Of course, please stay home if you're able to. If you need to get groceries, find an hour where there are few people out and about doing it. Don't leave home unless absolutely necessary. Continue to keep those 6 feet away from people. Pretend you're like my father and you just don't like people. And so you want to stay away from them if you can. Imagine everyone is in 8th grade and has horrible body odor. That's pretty much my best advice for you. If you feel sick, if you feel febrile, if you feel like you have a fever, if you're having chills, short of breath, things like that, stay home, isolate yourself. Some experts have suggested coming up with like a sick room in your home and kind of preparing it in the event that you do get sick or your loved ones get sick, to have a kind of a clean area with a bed made up, it not being too centralized or connected to the big rooms that people readily traffic in your homes, but just to have that as a space that's ready in case you do feel ill. If you or someone you know is having a lot of difficulty breathing though, if you're noticing that their lips are turning slightly blue or they're having a lot of anxiety or agitation, it's probably a good time to call 911 or call your local hospital and get checked out. There's been some big worry or wonder about whether or not you should be wearing a mask when you go out in public, as well as gloves. Which mask should I be wearing? Is it okay to wear a homemade mask? What types of personal protective equipment do I need? Do I need to be wearing that Papper hood when I'm going to Target to get some peanut butter? Those are really good questions. And currently it seems like the most important thing is to wear a mask when out in public. You don't need an N95 mask. You can actually just use a surgical mask. The only reason why you would need that N95 high viral filtration mask is if the virus was aerosolized, if it was an airborne thing. So when we in the hospital are doing an invasive respiratory procedure like ventilating someone, putting a breathing tube in them, there's a high risk for aerosolization of those viral particles. And so we need to wear that extra filtration. But predominantly this illness is transferred by large droplets. And so a regular surgical mask or even a homemade mask that just provides a barrier between your nose, mouth, and the rest of the world is perfectly adequate. Some people you may see or you yourself have worn gloves out in public. And while it's not inherently bad, I think there's a misconception that it's keeping you safe. If you have seen people wearing gloves out and about, touching things and doing whatever, and then touching their face, touching their face, readjusting their shirt, stuff like that, in effect, it's the exact same as their hands. There's not really an extra special barrier here. The virus isn't seeping into your skin or anything. Its main point of access is your mouth, your nose, your eyes. It's these orifices with mucous membranes. And so just wearing gloves inherently doesn't really help. And so my recommendation and the CDC's is that you don't really need gloves when you go out in public. However, a mask is pretty much required. I wear a mask when I go out, and at first I think it was a little bit, I don't know if embarrassing is the right word, because I'm used to wearing one at work, but it's a little strange going out and seeing other people in a mask. I'm sure some of you have felt the same way. But I'd say that over the course of the last few weeks and just seeing it become more, I feel, culturally accepted, it feels more natural. It feels just like a regular old thing to do. So if you see someone without a mask, maybe politely suggest to them that they wear one. You can always carry an extra in your pocket to help a neighbor out. But that'd be another recommendation. And then, like I said, just the last thing, refrain from touching your face or nose, head in general, if you can. Okay, here's a good one. This is the most important thing for a lot of families, I'm sure. How do I tolerate my kids constantly being home? Right? Everybody's got some people that are younger than them, and so just some assignment ideas that my coworkers and I came up with for people. Write a letter to an elderly neighbor, hospital staff, or someone in need. I feel that given this is an unprecedented time that is particularly stressful to many people and isolating and lonely, just showing people that you know or people that are in your realm of influence that you care can go a really long way, for sure. I know that at the hospital, we've gotten a lot of letters from little kids, pictures, drawings, things like that have been very supportive, and it really makes us feel good. Make an indoor campsite, share stories, things like that. Invent a new sport. I know personally, if you take a ball of paper, put a bunch of tape on it and start throwing it around, it'll turn into something eventually. Speaking from experience here. So that's always fun. And it's also a great time to get some spring yard work done. It's okay to go out into your backyard. It's okay to go for walks. There's not really much risk of being exposed just going out in your environment like that. The real risk of exposure is if you're in a highly trafficked public area like stores, like restaurants, things like that. So you don't need to wear a mask if you're just going for a walk. And then general advice for kids especially, it's very important to not only promote creativity, but to support their social development too. One of the main places they learn social skills is at school. And with that being limited right now, these are formative years for many of them. And so it's important to provide them with frequent social interactions, whether that be with Zoom or FaceTime or, anything like that with their friends, with other people. And I loved hearing about a kid coming to visit and throw some water balloons. I thought that was just great. It's really cool to hear. But also just to be frank and honest with kids, they can take a lot more than we think they can, and have them understand this disease and how it spreads, their risk factors, things like that. Some very interesting websites that I would just love to share with you. So this is one called COVID Act Now. So this is a group of people from Stanford University, Georgetown University, and one other that have taken all national and worldwide data about the spread of coronavirus and condensed it into an easy to use format for us to know initially when we needed to enact social distancing guidelines and stay-at-home orders, and now to know exactly how the disease is spreading. So if you'd like to go to the website yourself, it's covidactnow.org. I see, Wisconsin being yellow. So right now, what we're tracking is the positive test rate. So the percent of tests that come back that are positive for coronavirus, and then the infection growth rate, which is, hello?
When you click the link, it didn't take us to the website.
Oh, how about that? Okay.
You have to actually share that link if you want us to see it.
Oh.
I know.
Okay, let's do that then. So in a global chat, is that a thing?
No, if you just click the share screen button again, or stop sharing the PowerPoint and then share screen again and highlight your web browser.
How about this?
There we go. Yep.
Well, there we go. Can you see this?
Yeah.
United States. There it is. Okay, thank you. So here's Wisconsin in yellow, surrounded by all this lovely red right now. So if we look at that, this is that positive test rate that I was mentioning. We are at about a 9.8% positive test rate. So the number of tests that come back, about 9.8% are positive. And then this is that R naught that we spoke about earlier, 1.18, which, considering where we were in the middle of March at 2.06, 2.04 range, somewhere in there, that's great improvement. These social distancing precautions and guidelines really are doing a good job. So if we think that if we're down to 1.18, the spread of this is comparable to like peak flu season. So we're really getting there. We'd love to see it below 1. At that point, we can safely assume that the number of new cases will actually be declining. And if we see that for several weeks, we can know that it would be the most safe and intelligent to start opening things up en masse. But you can actually look by county. If you look at Dane, we're doing okay. This is incredibly optimistic, the look of only 1 hospitalization potentially in Dane County by June 19th, all this time. But decreasing restrictions could result in a second peak. So this is just one really great resource to use to show people. And then one other one that I'd just love to show you because I thought it was so interesting. Let me know. Can you see the PowerPoint again?
No, could you just type it in at the web browser?
Sure. Well, let me click it. It's a little bit longer.
Or click it in the PowerPoint and then it should open in the web browser.
Yeah, let's see.
There it is.
Yeah, so you see, this is from the Washington Post, and it's just a demonstration of exponential growth. So this is like a linear, or this is an exponential growth situation. And so these little balls, the orange ones indicate an infected person, and just how quickly it can spread to people. If everyone is moving around, living their life as normal, it's spreading incredibly rapidly. The more people that are sick, the more people end up getting it. The pink indicates recovered, although this doesn't take into account deceased. So here is if they try to quarantine it, eventually it breaks and it becomes the same exponential growth situation, resulting in mass infection and serious issues. So this graph being if we did some social distancing guidelines, if we restricted and then we lift too early, then it can spread rapidly again. However, if people stay at home, meaning these stationary dots, the spread is dramatically reduced in speed. And then if people are very, very strict in their stay-at-home order, the spread is, almost negligible, and the ramifications over a long period of time are much less. So that's just a really unique way to visualize the spread of this disease, and just a good way to explain it to people who are more visual. So that is that. We'll stop screen share. So now I just think it would be beneficial just to open it up to some questions. I would love to hear not only questions that you all have, maybe about specifically my experience, but about patients, how they are when they recovered, how they are when they get really sick, or if you just have any various questions that you'd like to ask.
Yeah, I have a question. I know there's concern about, surfaces, say, that people touch, and then the virus can be on that surface and transfer. I often think of desktops or tabletops or so on. What about other substances? Clothing, paper, like plastic containers in stores. What are the relative probabilities or relative risks of the virus being transferred to those items, and then we pick them up again?
Sure. So first things first, it has to be, this is just obvious, it would have to be a sick person interacting with the object first. So risk is relatively low because there aren't, millions and millions of cases specifically in Wisconsin. But by different surfaces, the virus can be transmittable for different periods of time. So for example, you brought up like cloth or clothing. Cardboard is another one. Those are more grooved. There are more like deeper crevices in those. And so data so far says that on cardboard, it can survive for up to 6 hours is an estimate, 3 to 6 hours. Some people have said around 45 minutes even, but I think it's better to play on the safe side of about 6 hours. So if you think about a box that you would encounter at a grocery store or something, or at any department store, it would behoove you to not touch things if you can, because if someone came by even hours ago and touched that, was fiddling on it, rubs their nose, touches it again, that then becomes a fomite, a non-living thing that transmits a disease. So cardboard and cloth are between 45 minutes and 6 hours, somewhere in that ballpark. And then things like rubber or plastic, some data that's come out that I read showed that it could be up to like 6 days it could survive on that stuff for. I remember reading an article about the Princess cruise ship saying that it was detectable for up to like 17 days, although I think that's a little bit harder to prove, just because there were a lot of people on there over the course of those weeks. Kind of hard to pinpoint that it came from those initial people. But yeah, general, preventative then, what steps do we take knowing this knowledge? When you get a cardboard box from the mail, it's probably safe. It's in all likelihood, it's probably fine, but it would be fine to take like a Lysol wipe and wipe that down real quick. If you go to the grocery store and get those plastic bags with your groceries or whatever, you can bring those home. You really don't need to, and this is just CDC guidelines, you don't need to wipe those down. They say risk of transmission in that way is very, very low. If it's just interacting with the people who are bagging your groceries and it's really only 2 points of access if they're hand hygiening, if they're washing their hands in between each thing. And so current guidelines say that for groceries and plastic bags, you really don't need to be wiping those down.
We had talked about sending letters to people. I'm just wondering, what's the risk of transferring paper, of the virus being on paper that we transfer between us?
It's very low, very, very low, and so almost negligible. I mean, unless someone is sick with coronavirus and is actively like coughing on them and touching them and then immediately handing them to someone else, that would be higher risk. But putting it in the mail or dropping stuff off and then hours later having someone pick it up, that it's fine. One thing that I think is interesting, I was just reading this with my colleagues. The viral load in a person affects the rate of transmission. So the viral load being the number of viruses detectable in a certain volume of blood or a certain volume of sputum, whatever. So let's say someone, worst case scenario here, let's say someone gets the virus and is in one of the less than 5 to 10% that are asymptomatic, meaning they have no symptoms whatsoever. They don't know that they're sick. The viral load in them is actually lower than the viral load in someone who's in a full-blown infection in critically ill condition. And so if they're asymptomatic, yes, it's scary because they can spread it and they wouldn't know it. But because their viral load is lower, the risk of transmission is lower. Yeah, good question. Risk is pretty low.
Luke, how do people get tested? Who should be tested? Are you tested when you go to work? And are there enough tests?
That's another really good question. Testing's been the most important thing. If we can detect the people that are sick, we can isolate them. So I'll answer first if we are tested when we go into work. So we're not tested, but we are screened. Symptoms of coronavirus include fever, shortness of breath, fatigue, malaise, nausea, nausea, a little bit of diarrhea sometimes. But predominantly it's fever. It's between 88 and 99% of patients who get coronavirus have a fever. And then shortness of breath is about 85%. So if you have one of those two symptoms, it's likely you have it or there's a high risk for it. So when we go into work, we get our temperature taken before we get to enter the hospital. and we are asked if we're having any new symptoms, and then we report those immediately. If we are having some symptoms at home, we're having shortness of breath, cough, things like that, then we call into our occupational health line, and they will advise us whether or not we need to be tested. For the general population, though, you don't need to be tested if you're not feeling ill. If you're taking the proper steps, you're preventing the infection, but if you're not having any symptoms, there's no real need to be tested. However, if you start to feel short of breath consistently, dry cough, if you feel chills, if you have a fever greater than 100.4 degrees Fahrenheit, then it's really important that you call your primary care provider, any urgent care in the area, or even any emergency department if you don't have any other number. But first course of action would be primary care provider. And then they will advise you to come in and get tested under very specific parameters. We don't want everybody with coronavirus symptoms just coming into the emergency room or the clinic unannounced, because it's so contagious. We want it to be very controlled. We'll use specific entrances, and they will advise you over the phone. So most important thing with testing then is you don't really need it unless you're feeling symptomatic in any way, or if you know that you've been exposed to someone who does have it. And at this point, I think we're doing a lot better with testing. When this first started, testing didn't exist. We didn't have, RNA transcriptase monitoring for things. It's been developed and perfected slowly. So the first tests that we had took between like 2 and 6 days to get back. Now we can get them back in as quick as 45 minutes. So I do think that we're doing a lot better with testing, and we do have enough. But yeah.
Does the test look as terrible as I've seen the YouTube videos with that swab going way down the nose?
In my experience working with patients, when they get to us, this one I think of in particular was intubated when he arrived, and then was on like max levels of sedation medications, so totally out of it. Like you could pick up his arm and it would just drop back down to the bed. When I put the swab in way back there, he was like with everything. So it is a little bit rough. It is. And the worst part is that we have to get it way, way back into the nasopharyngeal area, like right where the back of your throat meets, like, the back of your throat. And we have to do that for 10 seconds. So it's very uncomfortable, but to get a good answer, we have to get all the way back there. If you just do the nasal area, the sensitivity is pitiful. It's really terrible.
Yeah, that seems like motivation enough for me to not want to be around anybody.
I think on billboards, we should just put pictures of people like grimacing at the swabs. Yeah.
Have you seen changes in the way you treat patients in terms of as this developed? Things that have surprised you or in that regard? Or?
Good question. This disease in critically ill patients spreads very quickly and progresses to a kind of like a syndrome called ARDS, which is, it's basically like the deep parts of your lung, the alveoli, just become impermeable to oxygen, produce a massive amount of sputum, and just fill your lungs with this junk, and then require a massive amount of positive pressure from a ventilator to keep open and to provide oxygen exchange. So we treat it like ARDS, which is acute respiratory distress syndrome. However, there are interesting treatments that we've been doing. UW was part of an experimental study done just several hospitals around the nation, where we actually gave convalescent plasma from coronavirus survivors to people who have an inactive coronavirus infection. So we take plasma from those recovered people that have those antibodies, and then inject that into people who are sick, in hopes that that would act similar to like a vaccine almost, because the vaccine is usually an attenuated or a dead virus, and the antibodies that can kill it, we inject that into people, and then they get a very muted version of that disease because their body has those antibodies then to be able to take care of it. So that was one experimental study that we've been doing. Whether it's positive or not, we need to wait for the data to come out. But that's one thing for sure. I know there have been positive results with remdesivir, which is an antiretroviral on the market. I think the average length of hospitalization for an acutely ill person went from 15 days to 11 days with a p-value of 0.001, which is a strong correlation between taking remdesivir and a quicker recovery. So that's very optimistic, certainly. As far as if we're giving that, I have not given remdesivir personally, but I would assume that in the coming days, as they ramp up production of that, that will probably be a thing.
So
If someone passes away from the virus, how long does the virus live in the body?
That's a good question.
ooh, let's stump Luke.
That's a really good question. My initial answer would be not terribly long, because a virus needs living cells to replicate. It doesn't have its own replication mechanism. It needs to hijack a living thing. I will tell you, let's just pretend everything's buffering for a moment.
But if it needs a living substance to continue to live, it lives on paper and cardboard. So
Correct. It's transmissible on those surfaces, but alive is kind of a misconception with a virus, just because it's not by scientific standards alive. It's more of just transmissible. It's something that if it encounters then a living host, it can start to replicate. It can just remain on those surfaces. So I would say in a person who has passed away from it, I would guess about a day.
there's a lot of people handling their body. What care is taken at the hospital to remove that body and through the funeral homes and even just leaving the hospital.
Right, especially in New York and some of these higher population cities, it's rampant. I mean, truly at the point where they're in damage control mode and not in prevention. It's tertiary care. It's just trying to prevent it from getting way, way, way worse. And so in that, wearing full personal protective equipment and disposing of human remains is the best thing. However, in Madison, we haven't had too many people pass away from it in hospital, and our normal PPE requirements are enough to prevent transmission there.
What's PPE again?
Personal protective equipment. It refers to hospital things like gowns, gloves, masks, face shields.
Okay.
Luke, if I haven't been anywhere for the last 5 weeks and my grandchildren haven't been anywhere for the last 5 weeks, what is the reason that I shouldn't be seeing them?
If you have been asymptomatic, if you haven't had any signs of the illness and you haven't gone anywhere, yeah, your risk is zero. I guess you could get it just driving to their house, but at least in what I'm thinking of right now, there's really not much risk. It would be okay to see them. Still making social distancing.
So being asymptomatic is temporary. It's not like if you have been asymptomatic for more than 2 weeks, then you're clear.
There's a little bit of variation there. Average life cycle of the virus in the human body is about 15 to 21 days. So the estimate for like self-quarantine after you've traveled somewhere being 2 weeks is good. Usually you develop symptoms by then. And if not, chances are you're probably good. Yeah. Okay.
Have you, can you say if any staff have gotten, or I mean, I'm not trying to violate HIPAA laws, but like, has anybody gotten it from the patients?
So I don't know about from the patients. I know that like a handful of staff members, not on our unit, but a handful of staff members, like maybe like a dozen, less than a dozen, have tested positive. And this is just word of mouth from what I've heard. Have tested positive, but since it's a community spread disease at this point, meaning it's out in the world, it's hard to pinpoint if they got it from someone at the hospital or if they got it from someone at the gas station while they were filling up their tank.
And after people have the virus, one of our the volleyball coaches in my volleyball club got it, was in Spain, and is now back taking CNA training and trying to work. Could you speak a little bit about after a person has it, how they're able to not be affected by it?
Sure. So when you get a disease, after you've fought it off, your body's natural immune response has fought it off. The main way that we do that in the body is from antibodies. So it's an antibody-mediated immune response is what we call it. So for the average person who's got it, let's say this person, they develop these antibodies, and then if they encounter that virus again, it's possible they can get sick again, but their body is prepared with antibodies to fight it off. And so the second infection, if there was one, would be hopefully rapidly squashed and eliminated very quickly.
I'm wondering if can the infection enter the body through cuts and scrapes?
Yeah, yes, it can. So if you have a cut on your hand, it's important to put like a Band-Aid on it, and then again to perform really good hand hygiene.
So you were mentioning, the gloves not being that crucial. I'm just sensing that spring cleaning, garden work, cuts and scrapes, maybe gloves are a good idea.
For someone who has works with their hands frequently, I'd say for them it could be worthwhile, yes. But then once you get back to your car, wearing those gloves in the car, touching things, taking them off, and then using your just bare hands to touch your car again, that would be a point of infection. And so maybe, it's tough because if you're loading groceries into your vehicle with those gloves still on, they're in your vehicle, you have your gloves on, you take them off, hand hygiene, go home, and then you're unloading groceries again. And if you have all these cuts and scrapes, touching all that stuff that was just touched with your gloves, then there's not much of a point. I'd say a Band-Aid would probably perfectly suffice.
Where do you go for testing?
But that's just what I can think of right now.
So can you talk to whether or not the hospitals are opening up again to elective surgeries or procedures or things that they had really clamped down on? Any word on when and if that's happening?
So I've heard that it's relatively soon we'll be opening up to urgent cases. Right now, it's predominantly emergent that we've been opening up to. So people that come in with massive surgical needs get the surgery. So soon we'll be doing an urgent basis thing. Can include more like cardiac catheterizations, things of that nature that are important, but not life-saving in the moment. They're not like we need to do this now or that's it for the person. From there, I would assume that we'll start opening up to general surgeries, elective surgeries, once that R value is below 1 for about 2 weeks, just like with the rest of the state and country really starting to open up again. So
And
best estimate. Go ahead.
You know how has the healthcare community been impacted? Obviously, we need staff who can be and working in the units that are specifically addressing the COVID crisis. But I've just heard that there are other, layoffs or things where people are being impacted. What's your awareness of that, and when some of those folks might be able to get back to work?
Yeah. So initially we thought, if every state ends up looking just like New York is right now, we're going to have great need for nurses and we're going to be very short staffed. However, because we've taken all these mitigation techniques and the infection has been reduced to, a more manageable standpoint, many people are out of work, especially healthcare providers. I read an article that said that of like the 4-point-something% GDP loss in this last quarter, half of it was because of healthcare loss. So how they are doing, I know that EW has been supporting them pretty well. But the plan will be to, once we start opening up those elective surgeries, once we start opening up those clinics and things like that, then they'll start getting back to work too. I can speak to our unit though. We right now are overstaffed. We have too many staff, too few patients. COVID seems to be on the downtrend, apart from new cases still increasing. And so we don't have many ICU acuity coronavirus positive patients. And so we've had to flex off, sometimes mandatorily, nurses in a given shift, meaning that they have to stay home. And that's a mandate and not just, would you like to stay home? Of course, that, just like many other Americans who are not able to go to work, is difficult financially for those families, for those nurses. So there have been some policies enacted to give people a choice if they would prefer to be flexed off, or if they'd prefer to float to another unit if there's availability on those units, or what. So they're trying to work with us. But certainly, just like everyone else who's unable to go to work, it provides that gap.
What is the current thinking on fewer heart attacks? Is it people are just not going to the emergency room if they have like pain in their arm or some of the common symptoms because they're afraid of the virus? Or is it truly we have less heart attacks right now?
Yeah, I read an article about that recently, saying that the number of heart attacks in the United States has decreased as a result of the coronavirus pandemic. And I think you're absolutely right that people just aren't going out into the community. They're not going out and exercising as much. Gyms are closed. They're not going out and being put in high stress environments or at work where they're exerting a lot of effort. Some of those things can initiate angina or an infarct in the heart. So I think a big part of it is that they're just not going out and getting into these environments that they would usually have a heart attack. But I can't speak to if it's just them not being reported. I don't think it's that. I think it's more that they're just not going out.
So we're at time. It's 1:15. I guess, do we want to maybe take one more question?
Well, this is John. This is a two-part. First of all, Luke, thank you and your mom and all the other people working in healthcare. Thank you very much. And thank you for coming today. It's an amazing presentation, super helpful. And I just thought generally for the group, you talked about PPE before and described the things that healthcare workers wear. It's probably worth it for those on the call who don't know. PPE is an industry term that can cover anything in any profession. So if you're a construction worker, your hard hat and your steel-toed boots are considered PPE. If you're a flag person, a fluorescent vest would be PPE. If you worked in, tree clearing and you wore face goggles or something. So PPE just covers anything that's helping you in your job. There you go.
I totally agree. It is. Oftentimes we get in the healthcare mindset of it's just, just gloves, gowns, things like that. But yeah, I do believe, you're right in that. I'd just like to say thank you to all of you and to your families, to your friends, all that have been so diligent in your social distancing guidelines and the stay-at-home order and everything. We know it's hard. I want you to know that we talk about you all regularly at work, and our hearts truly go out to you. Thank you so much for just giving us a chance to not have our hospitals completely overwhelmed. You've saved many lives from this, and you provided a safer, healthier work environment for us as well. I'm so hopeful that soon we can all put this behind us, that this can be a thing of the past. It sounds like within the next 6 months, we're looking at a vaccine. And I won't necessarily cross my fingers for it being sooner than that, but we can all stay tuned. But for now, I think we just need to continue on with the precautions we've been taking and just being smart in how we're living. But thank you all so much for having me, and thank you for everything that you've done. We really are thankful.
Thank you, Luke. It's the quietest clap I've ever heard. Well, just so you know, our club, for all presenters, we make a donation to the End Polio Now campaign. So we'll be making that in your name. I want to thank you very much for speaking today and providing some clarity and some hope, I think, as well. But I appreciate you coming on very much, and hope you stay safe.
Thank you.
And ding, that's it for us Rotarians. Yeah, so next week we're going to be bring your dog to Zoom day, or bring your cat to Zoom day. So watch for an email on our next presenter, and that should be going out on Friday. Thanks again, everybody.
Bye, everyone.
Bye.